Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
You out there in TV land are watching Healthy Living right here on KUM News Extra, and we are here in Harmon, and the good Dr. Jitka Lom from Express Care is joining us tonight. We are talking about arthritis, and now is the part of the program, Doctor, where we take the Facebook questions. So got some good ones for you tonight. You ready?
Yes.
Okay, and these are challenging. So our first question comes from Tina Lynn P., and she is from Laddie Heights. Thank you, Tina, for posting this on our Facebook wall. Tina says, Doctor, I am over 40 years old. What are some of the symptoms of arthritis to look out for?
Okay. Well, Tina, just look out for any pain that you may be having in your joints, again in the thumb area or the tips of the fingers, sometimes getting stiff and sore. Hips and knees also may be getting sore. Try to keep your weight nice and low so that you don't put more strain on the joints than you need to. And stay very active. Stretching, yoga might be very helpful for you to prevent problems.
Now, you said, typically, and that's just the nature of age, when we get older, like when you stand up, your knees pop, your ankles may have a tendency to crack and everything like that. Should you worry?
Not if it doesn't hurt. If it doesn't hurt, the cracking is okay.
Okay, good tip.
Yeah.
All right, our second question comes to us from the Capitol. This one comes from Hagania. This is from Kim. And Kim asked Dr. Lom, why does arthritis-related conditions affect more women than men? You touched on this in the first segment.
Well, as far as osteoarthritis, it would be equal, but as far as rheumatoid, it is an autoimmune disease. Autoimmune diseases occur when our own body attacks itself. So for whatever reason, one day your body wakes up and decides that certain components of your joint are the enemy, and it will attack them and cause inflammation. That tends to also happen with thyroid problems, with diabetes, with other endocrine problems. And for some reason, it happens more in women. There are a lot of theories, but it's not really known exactly why.
Okay, now real quick, does osteoarthritis cause osteoporosis?
No, they can coexist. Osteoporosis means when the bones are very thin and weak, and they've become that way over the years. Osteoarthritis is a problem within the joint.
Okay.
Yeah.
Okay, well, maybe that's a future episode. We can talk about osteoporosis. But as for now, this next question has to do with osteoarthritis because ML asks, can osteoarthritis develop into rheumatoid arthritis?
No, they're completely separate diseases, although they can end up looking kind of similar. But they attack different joints oftentimes. So for example, osteoarthritis will attack the end joints, whereas rheumatoid arthritis will attack the larger joints of the hand, for example. So they have sort of a different pattern, but in the end it can result in the same type of disability of swelling and pain and stiffness. Okay,
well, Jason Teidigui has our next question, and no village for Jason, but he actually asks about the treatment of arthritis. He says, are there any medicines or treatment to fully treat it? And it's interesting how you refer to arthritis as a disease, not a general ailment or not, like a minor injury.
Yeah, it is a disease. But as far as what can be done to treat it, there is a lot of hope. And for the diseases like rheumatoid arthritis or gout, there are specific treatments for those, which involve, for example, steroid medicines taken by mouth, or what we call disease-modifying agents, where they're injectable shots, or even, for example, gold is used as a therapy, injected. For rheumatoid arthritis. For osteoarthritis, there are gels and creams that you can use to reduce the pain. You can take Tylenol or anti-inflammatory medicines. Physical therapy can be helpful. But basically, it's in all of these, they're chronic and degenerative, meaning they progress. And we want to do everything we can to prevent disability, especially in the activities of daily living, so that people can still button up their shirts and use the bathroom and be able to use their key to open their door. And
for
all
very
those,
precise movement.
Yeah, all those minor things that we take for granted.
Okay, our last question comes for us from the Center Village of Totu, and this comes from a user logging on as Concerned Mom, and we can see why in this question. She writes, Dr. Lom, is there such a condition called juvenile arthritis?
There is. It's not very common, but it does happen in children that they should get arthritis. This would be, again, an autoimmune condition where their own body is causing inflammation in the joints, attacking itself. It's not that common, but it can be diagnosed if a child is having pain in their joints. X-rays and blood tests can be done.
Okay. Now, I have a question before we wrap the segment, so, ma'am, if I
Yes.
may. Does doing this constantly and, popping your neck and all of that, self-chiropractic stuff that probably isn't too good for you and everything. Can that actually cause arthritis, though, if you pop your knuckles?
No, it doesn't. The popping is a release of a little bit of gas that is present within the joint, and it'll pop and you'll hear a little sound, but you cannot hurt yourself. Stretching and keeping yourself limber and flexible is actually incredibly helpful for prevention of the complications of arthritis, which are contractures and stiffness. So keep cracking, keep popping, keep stretching.
All right, keep cracking. That's good advice. Okay, so doctor, as always, thank you very much for your
Thank
insight,
you.
and we'll see you next week.
Thank you very much.